Urge urinary incontinence is a strong risk factor for a number of negative health outcomes in the elderly, including falls and fractures. It's also quite common. About a quarter of older women live with the condition. Its symptoms give some insight into its association with an outcome like falls. Urge incontinence causes increased daytime and nighttime frequency of voiding. Urgent trips to the bathroom, especially at night, increases fall risk. There's also some evidence that just the fear of finding oneself too far from a bathroom can reduce out-of-home mobility in the elderly. And the consequences of low mobility in this population are well established. A debilitating spiral of deconditioning, muscle weakness, frailty, loss of confidence, and falls. Although a number of studies have included incontinence within multifactorial analyses of fall risk, few have specifically examined the effects of a targeted intervention to reduce incontinence on a fall-related outcome. For this pilot study, we conducted a double baseline, single group, pragmatic trial to test the effects of a physical therapy intervention to reduce incontinence on fear of falling. We enrolled 20 women from 2 outpatient clinics associated with our university health system with urge or mixed incontinence, and also scored at least a 20 on the Falls Efficacy Scale International. The Falls Efficacy Scale is a validated measure of fear of falling. The first baseline assessment occurred at least 1 week prior to the start of therapy. We measured indicators of the impact of incontinence on the person's life, social participation, mental health, physical functioning, and provided a step activity monitor that was to be worn for 1 week. The second baseline occurred on the day of the physical therapy evaluation, and then 4 weeks later at the approximate midpoint of therapy, and then 8 weeks later at the end of therapy. At that time, the subject was given the step activity monitor again and asked to wear for another week. Then we followed up 1 month later with a phone call and re-administered the Falls Efficacy Scale. The intervention consisted of progressive pelvic floor strengthening exercises, core stabilization, behavioral training, and functional activities that incorporated pelvic floor activation. We hypothesized that fear of falling would decrease in step with improvements of perceived impact of incontinence on the subject's life. And that's pretty much what we saw. So the graph you're looking at now shows our 2 primary outcomes over the baseline, mid, end, and follow-up assessments. The y-axis on the left shows the Falls Efficacy Scale, which is blue on the graph. The y-axis on the right shows the Incontinence Impact Questionnaire, which is orange on the graph. It can be seen that the 2 measures followed a very similar trajectory and that most of the improvement occurred in the first 4 weeks of therapy. Though we weren't intentionally powered to test for statistical significance, there was statistically significant improvement in both measures compared to baseline. There was also significant change in our measure of social participation. And though not statistically significant, on average, subjects walked about an extra 1,000 steps per day at the end of therapy compared to before the start of therapy. So in conclusion, findings from this pilot study suggest that a physical therapy intervention to reduce incontinence in older women may also be an important treatment consideration for reducing fear of falling.